Now we'll call a meeting to order. Roll call.
Okay, Clarence Hampo,
Here.
Richard Huber,
Here.
George Boussaint,
Here.
Laura Negro,
Here.
Dr. Keller,
Here.
Dr. Horning,
Here.
Joy Henriksen,
Here.
Elizabeth Franick.
Here.
That's it.
Okay. Second item is public hearing to receive input regarding changes in the fee schedule pursuant to updated Wisconsin Administrative Code for hotels, motels, and tourist rooming houses. I don't believe there's anyone present who has any input in the public hearing. We'll keep the public hearing open for a period of time in case someone comes online or stops in and wants to make comments. Otherwise, we'll go on with the regular agenda. Approval of the agenda. Move to approve. Motion by George.
I'll go ahead.
Is there a second online or Dr. Horning? Motion by George, Dr. Horning seconds to approve the agenda. All in favor?
Aye.
Aye.
Opposed? Motion carries. Now we have public comment for pertinent to agenda items, resolutions, and ordinances. And again, I don't believe there is anyone present or online. We'll move on to approval of the minutes of the last meeting. Any additions or corrections to the minutes?
I would move for approval.
Motion
This
by
is
Dr.
Laura Negro, a second.
Seconded by Laura. All in favor?
Aye.
Opposed?
Aye.
Motion carries. Discussion items, 2025 year-to-date expenditures.
Okay,
Remember,
so, what we have on here is basically reporting expenditures received as of December 31st. And revenue received as of December 31st. So honestly, overall, looking at overall, we're sitting, I'm content where we're sitting. This is gonna still change quite a bit because we continue to receive revenue through now, even through March a little bit. And we're doing our final billings for 2025 between now and March 15th. So I'll have a better idea. We'll have more of a final report at the April meeting. So it will change. But I kind of like where we're sitting, knowing that there's actually more expenses than revenue shown on here too. So I know that that will change overall. You'll see some line items that are over budget, but until we are recording all the revenue, it's, you know, I'm not saying that we're over budget yet, because once we record the revenue, that will lower the levy and change all of the numbers, so. But say kind of where we're sitting right now with everything that was reported through December, was looking like we're gonna come in, you know, within budget. And maybe even a little bit under overall, so. Does anybody have any questions for me?
any questions for Amber? If not, we will move on to child support, the move and resulting budget implications.
So that's me. Not that there's gonna be huge budget implications, but we did move offices. We have been cited by the state for like the last 6 years that we were not up to code of where we were for the federal regulations that we have to follow with the information that we have. So we did end up moving where UW Extension was, and then the administrator's office, if you haven't been over there yet, moved to where we were, and then UW Extension moved into where the administrators were over at the courthouse. So we are now up to code, but with that came, we had to have Joma Electric come put in some different electrical things so we could plug our stuff in. And then we had to have locks put on all of our doors. So I'm in the ballpark of about $3,000 that I didn't budget for because I didn't know we were going to be moving. It was very sudden and we gladly took it, but not a huge amount, but amount that I did not budget for. So
George?
What were the cited deficiencies?
so we have access to federal tax information, which not a lot of people do. So we have to be behind 2 locked barriers, and we each have to have a door and an office. And we did not have that.
Had some shared office space, right? So-
We did, yeah,
So,
yeah.
so
Yeah.
there was a lack of privacy, I
Yeah.
guess, and. Any questions for Kelly? Has everything been completed now?
Yeah,
Or-
everything is, I mean, we have some stuff out, not we, but UW Extension has some stuff out in the hallway that has to be brought to the dump yet, but other than that, everybody's in and, yeah. Yeah, they had to do quite a bit of downsizing, so, yeah,
Well, I think they, yeah,
so.
Are you the one that, are you the department that needs some new furniture then, filing cabinets and stuff too?
Nope, that was not
That
us,
different
no.
one. Okay, I was
Yeah.
just wondering if there's 2 of them or just one, okay.
Mm-mm.
okay, thanks, Kelly. Now we move on. First actually, we should have had a motion and a second to go into the public hearing, which we didn't, I don't think, did we?
No, we didn't.
So we don't need to actually come out of it. Or I suppose we could go into it back out. Approve changes to the fee schedule for hotels, motels, and tourist room houses.
So that is me. So on page, what am I on? Page 10, under lodging, it's highlighted in red. So that's currently where the fee structure is at. And DACCAP has adjusted everything. So the new state rate is actually going into effect. So the new requirements under ATCP 72 for regulations as far as like safety protocol, number of like smoke detectors, fire alarms, all of that stuff. All of the safety regulations are in effect, and the new fee structure goes into effect on April 1st. So the fee structure that the state has proposed is outlined on page 12. It's listed under the gray column of the state rate annual fee is what the state is proposing. What we are proposing for our rates is highlighted in the yellow column because we do have to pay a percentage back to the state then. And it is incrementally increasing on an annual basis over the next several years. Anticipated, they say it's going to top out at 15%, but it is anticipated it will increase again beyond that. We do anticipate that because then they have another fee structure to be issued in effective April 1st of 2028. So they're increasing it this year and then it's going to increase again in 2028. So we would like to adopt their fee schedule with our adjusted rate to accommodate what we have to pay them and not. Yes, to be fiscally responsible with our program, this is what we would propose doing.
Any questions for Liz on this?
So do you have any doubts or qualms about this at all yourself? And are you comfortable with this?
The state did give a bit of a jump for some of them compared to what they previously or to what previously were to what they are now, but these rates have not specifically, like the hotel, motel, tourist rooming houses have not been adjusted in a very long period of time. So, I mean, when you look back over it, it really does kind of make sense, and knowing what the going rate, I'm gonna pick on tourist rooming houses. Knowing what the going rate for a tourist rooming house is per night, these fees are reasonable compared to what they're charging a renter for the night.
How significant an increase is this versus what we've been charged?
The old rate for a tourist rooming house, the annual licensing fee was $155. The new rate for the annual licensing fee will be $340.
So it's like here's some pushback. That what's on the increase, right?
It's a one-time annual fee.
So if we paid the annual fee last year, it'd just be 100% increase.
And they charge $500 per night for some of it.
That's not our problem. Our problem is when they complain to us, right? I'm comfortable with it, but I just wanna know.
No, just ask them how many times they've increased their
There.
rent, their,
Not worried about
Costs.
this problem, worried about what they complain about.
DACAP has sent out notice multiple times to all of the licensed owners, so they have been forewarned. Our staff have sent out notice a couple of times already, so everybody is forewarned that the new rates will be coming April 1st. If we don't adopt the rates, we will be paying our percentage based on what the state rate is, regardless of if we increase our rates or not. So if we don't increase our rates, we're going to be paying their percentage off of our previous rate of 155, and the program will not be able to maintain staffing.
I support it, I just wanna know what
the
the
state,
state.
the state made us do it.
I see that Laura has a question. Laura has a question online here too. So does any of this fee structure work for all the Verbo and those kind of housing rental units?
Yep, that would all be under like Airbnb and Vrbo. Those would be mostly classified as tourist rooming houses.
Okay. Because it said individually keyed units and it's like, okay, so if they're having 15 people in one house, this is that like but there's only one keyed door, is that move them on that scale, or is it just it's one keyed door?
One key door.
Huh.
They have very specific language which classifies them as to far as like the number of units. And then there's also very specific language about the official number of occupants that they can have per unit based on their septic and what they are zoned for.
Well, we hope that reins them in then. Thank you.
Any other questions? We probably need a motion to approve the new fee schedule.
I'll make the motion to approve the new fee schedule.
Second that.
Motion made by Rich, seconded by Matt to approve the new fee schedule for hotels, motels, and tourist room houses. All in favor?
Aye.
Opposed? Motion carries. Approve updated public health water laboratory fees.
That's me again. So we did some number crunching, looking back at our rates for bacteria, nitrates, and nitrites. These fees have not been adjusted in over 8 years, because that's how long I've been here. So breaking it down, I just have kind of the very brief cost analysis that we have. So like for bacteria testing, the cost of the actual bottle and the test supplies is not significant, but the staff time on average it takes 30 minutes with all of the paperwork, with setting it up, running the test, reading the results, everything like that. So everyone that is certified and approved, that's done the annual checkoff to actually set up and read the water tests, I averaged out the salary for those individuals, and broke it down for staff time, for the 30-minute time period. So the actual cost theoretically would come up to $32.78 for bacteria. So we would propose increasing that rate to $35 to ensure that we're at least covering the costs of everything for it. And then for the nitrite and nitrate testing, that cost is a bit more expensive. So we actually do send out those tests to UW Oshkosh. So they drive a lot of the cost setting rates for that. So again, the average staff time is essentially the same. There are shipping and handling fees that are set per UW Oshkosh, and then the actual cost of the test is decided by UW Oshkosh. So we have no over those. That's just, it is what it is. And so it does significantly increase the actual cost, estimated to be $69.78 per test when it comes down to the shipping and handling and the actual cost of the item. I did not directly include the cost of driving all of these supplies over to Washburn, which is the closest shipping location that we can send them out of. We just rounded a bit and proposed the new rate to be $75.
That's just,
Go ahead, Derek.
are there other water contaminants that people ask about?
Heavy metals, arsenic.
In their water supplies, they're worried about that?
We do get requests for some other things. Generally with those, we'll refer to the Wisconsin State Lab of Hygiene, depending on what the test is. They do have some fee exempt testing available, and we're able to, if they qualify for the fee exempt, we are able to get some testing supplies. We work with WIC on some of those, where we're able to do fee exempt testing for some individuals.
Any other questions for Liz on this? Otherwise, again, we'll need a motion to approve the updated water laboratory fees.
Make that motion.
Dr. Martin,
One second.
second by Dr. Keller. All in favor?
Aye.
Opposed?
Aye.
Carried. Approve updated public health lead follow-up and case closure policy.
So one more, this is just a updated policy for our lead case follow-up for kiddos with elevated blood lead levels and exposures. CDC recommendations and state of Wisconsin recommendations have been adjusted quite a bit over the last several years as far as what would be considered a acceptable level of lead, which in reality there is no safe level of lead as far as exposure is concerned, due to the long-term potential for adverse health effects. So currently the recommendation is 3.5 or below. So this policy just kind of outlines everything that we do as far as monitoring when a case investigation or environmental health investigation is initiated, and when we're able to then close that case.
George?
How do those cases get initiated? What happens? What triggers an assessment?
When the blood lead level is,
But how do you detect, when does that get flagged?
it's recommended per CDC, I have to get the right acronyms. American Academy of Pediatrics is, I think, the right one for this. So it's by ages 1 and
Yeah, you got it right in there.
3, do I have it
Yeah,
right?
Yeah, it's
all children age 1, again, 2, or between 3 and 5.
Is this
So the
doctor
doctor,
recommended?
yeah, so it happens that they come in for a 1-year well child visit. Bring in your kid, you get your MMR, your measles vaccine, and get weighed and measured, and the doctor says, have you done your lead screening? And if they go to WIC does it automatically. If they don't go to WIC, then yeah, your clinic, your doctor could help you do that.
So when do we get involved then? The doctor recommended it, the doctor's gonna talk to it, Rick's gonna talk to it, how do we?
So all of the levels are automatically, once the lab results are obtained, they're automatically reported into the health system. And then that system will send us a notification when we have a new lab report that comes in. So we just monitor the lab reports, and depending on what the lead levels are, if they're within a certain range, we will contact the family. Request a venous confirmatory testing. So typically the initial test is done with just a capillary test, so a finger poke. If it's an elevated level, we'll request the venous confirmatory, so then they will go back to the doctor's office and have an actual blood draw done. And then based on that result, we will follow up accordingly, whether it be an environmental investigation, referral to WIC if they're not already involved with WIC, for nutrition, education, counseling.
And what's the update that we're trying to approve it?
Just the policy.
But I mean, are there changes in the policy to be summarized?
It's essentially a new policy. The old one was so far. Yes, a little outdated is a great way to put it.
That was 8 years ago too, or what?
So are there any highlights to new policy?
To summarize, this would bring us more in line with the current recommended practices and ensuring adequate follow-up for everybody.
Okay. You need approval, something? Yep. I'll move to approval.
Motion by George to approve this policy. Would you need a second?
This is Laura, I'll second.
Seconded by Laura. All in favor of approving the lead?
Aye.
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 Opposed? Motion carries. Next one is open discussion for input or comments to be passed on to the Ashland County Board Planning Committee with regard to the upcoming Ashland County Comprehensive Plan. Anything you need to say about that, George?
I do. I think at the last meeting, I requested that we talk about public relations. And since planning includes just about anything we want to talk about, it's on the agenda. So I just wanted to review where we stand in terms of our public relations, our visibility to the public of our services. Does anybody have any thoughts about that? Do we think we're sufficiently visible to the general public that they know that they can come to us? And for what they can come to us? Just asking the question. I'm seeing a lot of silence.
This is Terry. I can speak to that and the other managers can join in, but I think we do a good job. I think we might be able to do better with some social media. I think Bayfield County has a pretty robust website for all of their departments. We have mostly public health and the ADRC, and they do a lot of posting for us as well. But I don't know, what do the other managers think?
I would agree. This is Kelly. I would agree with you, Terry, that we could do a better job of possibly some social media. I feel like I see Bayfield County stuff, but I really don't see our stuff that much. But otherwise, I mean, some of our programs, they don't have a choice but to come, like, it's a court order. It's if you have food share benefits, you're referred to, if your kids are on Badger Care, you're referred to child support. Like, But other than social media, I don't know that we could.
Yeah. So website does list everything we do, we need to beef
Mhm.
that up a little bit, but like, I think social media, and Liz does a good job on her public health page, she kind
Yeah.
of all human services, but. I don't know, maybe Ashland County, as like, would wanna do a full, like, one for the whole county, and then we could all send stuff. to it.
Yeah.
So that, cause the highway has one, so I'm starting one when I was down there, and like, yeah, that was great, cause that's what I used to get anything out to the public that they needed to know.
Yeah, but if we even have a page on the Ashland County website, we put one up for the planning committee. And, you can go there and find out anything about what we've been working on as a planning committee. And it's just so easy, because it's just on that tape that runs on the bottom of the Ashland County web front page. And you just, you can click on the calendar, you can click on the planning committee, you can click, it's just one click and you're there.
Yeah.
Seems to be Health and Human Services, if we don't have that, we.
Oh, no, they're on there.
Yeah.
Yeah, it's under department.
Yeah.
And everything's listed that we do,
Okay.
we could, give you something we could look at to make it a little bit more. But I think most people don't go look at a website, they're looking at social media
Mhm.
nowadays.
Yeah.
And you can put a link in social media.
Yeah.
Yeah,
Yep.
yeah.
That's a tool.
I do
And
agree.
social media,
Yeah.
you can share social media. Like if I'm interested in something personally, I can share that with my whole entire group of family and friends, and then they can share. So it's kind of like electronic word of mouth, and I think it becomes a very effective form of communication.
And with the social media, so we do have our Facebook page, and I'd say on average, there's probably I know I just checked it today, there were a couple of new followers on there, so people are, public health page, so it's not like,
Right.
we don't get a ton of traffic, but it is, a reasonable amount of traffic that we do get that visits the page, shares the different posts and stuff like that. And it depends on what the posts are. Things with cute dogs and cats obviously go a lot farther. Some of the more comical posts get a bit, better. We had one, a reproductive health post that was just kind of a general information regarding reproductive health services, but it was a funny little meme with a dinosaur and a bacterium of, yeah. It was funny, right? Yeah, it did very well because, it's not exactly off-color humor, but it's humorous and it did very well. The page is definitely much more popular over the summer months because we post the beach status and the beach monitoring, and we usually pick up a lot of extra followers over the summer months with the beach monitoring and stuff like that. So generally people don't unfollow us once they start following. So, I can say that there's not a lot of unfollowing. I know some of the other health department pages are more popular, but may not necessarily be for the right reasons, because your internet trolls sometimes like to heckle and engage on the posts, and it leads to online arguments. We don't have commenting on our posts, and when individuals send us messages, they receive an auto response saying that the inbox is not monitored, providing contact information or emergency service information to please, redirect elsewhere. Because it is not regularly monitored for the inbox, we don't want someone to send us a message saying, I need help, and we're not able to, get to them in a timely fashion. So we provide those resources to redirect elsewhere.
I do think a
And
comment-
just to add, I'm sorry, just to add to Liz's comment about keeping the posts, it is highly recommended by our attorneys that we do that we not have any kind of commentary on there, because it could then become public record. And we would have to archive that for 7 years. And so it isn't in anybody's interest to do that. So we're going to stick with that. And it is the legal advice that we've received.
And this is just on Facebook for the social media platform, which Facebook is the old people social media at this point in time. The more popular, younger social media would be like your Snapchat and TikTok and things like that. And when it comes to the legal liability standpoint from Snapchat, TikTok, and platforms more similar to those, it's a bit more difficult.
We're not
It's
touching those. The only other one I would maybe do is like I've done with other stuff is Instagram. Like Instagram, again, still old people, but
Yeah.
young
Yeah.
people are also on it.
George,
Right, has anybody noticed that we're in the midst of an information revolution? So if you've done a search online for any kind of information you want recently, the artificial intelligence search response is almost instantaneous. So what's important is that our websites, our platforms have our information formatted in an easy way that those artificial intelligence searches are going to find our data when someone types in Ashland County Public Health, Ashland, Wisconsin, and boom, it'll be there almost instantaneously. So this artificial intelligence thing is going to have a big impact on how we can more successfully get our information out to people, because they will be able to find us so much more easily. But just to keep that in mind.
okay, any other thoughts or comments?
Yeah, I
Was-
can speak to that. People do find us fairly easily. So well, in fact, that Ashland County comes up when you search, if you don't specify Ashland County, Wisconsin versus Ashland County, Ohio.
Oregon.
It's all wrong.
I have gotten several phone calls from Ohio, so we are easily found.
I was gonna say something along the same thing because we have, for the aging unit, we have a cars donation program that we work through. And I've gotten donations from Ashland County, Kentucky, Ashland County, or Ashland, Tennessee, Ashland, Kentucky, Ashland, Oregon. There's 4 or 5 different ones that people just end up donating to us because they're like, oh, Ashland County. Oop. So that website optimization is really important. So
The Ashland County, Wisconsin, not Oregon, not Massachusetts.
Yeah, yeah. Okay, any other thoughts on that?
Thank you for that discussion.
And we'll move on to reports and updates. Update on adult drug court, wellness to recovery court.
Okay, that is me. I think some of you are aware, and some of you may not be, that we had a wellness to recovery court, which was an adult drug court. We've had it for years. We've had a drug court in Ashland County for 20 plus years. It started out as juvenile drug court, and it just kind of changed as the different grants came. But we've always, I mean, not always, but for many, many years, we've had a drug court. And we just recently, well, I woke up on January 14th to people that work with us saying, what is going on? A notice of termination was received on January 13th at 9:34 p.m. our time. This was coming from Washington, so it was 10:30 their time, saying that funding is terminated effective January 13th. They stated that we no longer effectuate the program goals or agency priorities, so that would be of SAMHSA. And then they went on to say, although in its discretion, SAMHSA may suspend rather than terminate an award, no corrective action is possible here, since no corrective action could align the award with current agency priorities. Then down the line, it said costs resulting from financial obligations incurred after termination are not allowable. Nothing in this notice excuses either SAMHSA or you from complying with the closeout of obligations. And so, you know, like do all this, it's closing out a grant is a lot of work on a lot of people's part. And so you're not going to get paid for it, but you have to do it. At the same time, the judge had already scheduled a meeting with the drug court participants for the 14th. And when they met, he discharged all of them from the program. So effective on the 14th, we no longer had any participants in the program. Then on the 15th, we received notice that the decision to terminate had been rescinded. Well, by then we didn't have a program left. And so anyway, by then it was too late. We are still doing a lot of outreach with those participants. 2 ended up back in jail. Some were doing really well, and we were extremely concerned they would backslide. So a lot of time and energy is being put into trying to keep them on the right track. The judge has stated that they are going to seek another TAD grant, which is a treatment alternative diversion grant, which they have one already. But that is not SAMHSA funding, so they feel the funding would be a little bit more secure. So anyway, we are still reaching out, offering treatment, recovery housing, CCS, you know, whatever they may need. We're helping with resources at that time, peer support. I don't know if I said that one. So it's extremely unfortunate and extremely unfortunate for the participants. And even if we somehow had gotten the grant back up, I think the trust level of those participants of, is this going to happen again? You know, I did all this work. I've participated in everything. I've followed my treatment program here. I've worked through the steps and now I'm just done. I will tell you the district attorney was very empathetic to the participants and did tell us as some of the stakeholders that he was going to really take into consideration who had been really engaged and take that into account when sentencing was recommended. So that's the update on that. Any questions on that?
Yes, that's Elizabeth Franick again. It's just very disheartening with this program being discontinued. And like you said, they're going to reach out for the TAD grant. Are there any other programs that would be a wraparound program for TAD? Or any other things that we can seek for our county because we really need these programs?
Yeah, I think it depends on what kind of program TAD is going to propose to run, and that, you know, that isn't something that we do, it's the sheriff's department. But as far as wraparound, we do have the CCS program, and we have been reaching out to the Department of Corrections. Julie has for CCS, telling them about our program, you know, what our program can do, and that is a wraparound program. It is voluntary, and we have worked with TAD participants in the past and also drug court participants, and I think it is a good combination and provides a more robust program for everybody.
Dr. Horning, you had a question?
Thank
Yeah.
you.
I guess first, just like how many people were in the program when they were all discharged?
I believe we were down to 11 because 2 had just been terminated. 1 was in treatment. But I think it was 11
And there's,
when,
oh, go ahead, sorry.
no, when the decision was made, I believe it affected 11 participants. We had 2 in the jail that were pending admission to the program, but they hadn't been formally admitted yet.
And there's no effort to restart drug court, or that may happen with this TAD grant. I guess it just seems like if we've had this for over 20 years and then we get this sort of federal mix-up, notice of termination and then rescission of that. Yeah, it seems like a terrible.
Well, yeah, but Dr. Horning, it was not a mix-up. It was planned and it was purposeful. And they did the same thing with one of Liz's grants. However, they did that on a weekend, so by the time we were aware of it, they had already rescinded the termination. And that's my opinion, but I believe that's the sense of everybody who was working with SAMHSA at the time. And it wasn't the people that we were working with, it was on a higher level. The people we were working with really tried to get us to change our mind, but the judge's mind has been made up. And without a judge, we have no treatment court.
Thank you.
Any other questions?
I guess, are we gonna do any, this is the first I've heard of this. I'm not like a gossip person, I guess, to maybe everyone else is talking about this in their social circles, but is there gonna be any PR on this, or, you know what I mean? This strikes me as, yeah, egregious. And if this is from, yeah, federal action, and this is part of this like Doge cuts SAMHSA, which I guess I've been waiting for that shoe to drop, and maybe this is it dropping in our community. But yeah, I guess what's the thought about how this is presented to the community?
I understand where you're coming from, but because the judge, there's no going back, I'm not sure it would have any impact locally. I mean, it would be more of a political statement, and I don't feel comfortable doing that. It's the truth, but since there's no potential to restart it, I guess, we can consider it, but I'm not sure if that's going to be beneficial.
Yeah, no, I'm not proposing anything. I was just for people that have like been sitting with this for a month. Yeah, what the thought is.
I guess the sad part about the whole thing is that the program has been successful over these years, and to just have it cut like that is a terrible thing.
Yeah.
Yeah,
Are
I mean,
there
there were
any
real lives
areas-
at stake here.
I'm sorry to interrupt this, Elizabeth Franick again. I was just wondering if there's any other areas that are doing different programs, and we could look into what they're doing, that maybe we can look outside the box a little bit and just kind of dig into different counties, even outside of the state, and see what they're doing as far as programs to rehabilitate people that are incarcerated or with drug and alcohol treatment problems. What kind of things can we think of that might be cost effective and maybe not have to search for federal funding? Maybe it'll be something that could be like a state grant, or maybe even volunteer program, like the community can be involved in a kind of a pot of money in the future.
I'm not sure. I recall several years ago there was a program, but there was a waiting list for the grant, and I've not heard of it recently, but it was called Stepping Up, and that was meant for people in the jail to kind of, it's been years, so I'm not sure exactly what it was, but it was a good program from what I recall, and I can't remember all the specifics. But yeah, I think we can be looking at that, Liz, and we have a grant writer, so if anybody is aware of something, send it to me, send it to Erica at the courthouse, who is our grant writer, and we can pursue any of those things. I don't think there's any funding for the county to take on anything that, they keep putting more mandated things on us and don't give us any more money, so that continues to be an issue. But certainly if there's a grant opportunity out there, we can explore it.
Thank you.
This is Laura. I have a question. I know there was a whole bunch of rules with our opioid money settlement. Is there possibly an opportunity to do some pretrial services for people with opioid use and try to work with the DA's office then?
I would have to check on that, but I'm thinking there probably are some possibilities about that. And we would, certainly be a part of that, but the biggest thing is going to be the district attorney and the sheriff's department on, what it is and how that would work and those kind of things. But we can, yeah, I mean, we're all for rehabilitation and helping people change their lives for the better.
Yeah, NACO, National Counties Association, has some resources on it, so uh, and depending on what it looks like, and then of course, like you said, it's a collaboration again. But that's how we always get things done, is collaborating.
I mean, and even if we start with the TAD program that we already have and add things to it, that might
Yeah.
be a good step, good way to start.
Thank you.
Okay. Update on coordinated services team program.
Terry, did you want me to go first?
Yes, please.
Okay. So the coordinated services team, our CST program, I guess I don't know specifically how many years the county has had it because it was before my time at the county, when it was really more of a philosophy of getting with kids who were involved with multiple systems. So if they were perhaps the children's unit was working with them and maybe they had an IEP at school and there were some mental health struggles or substance use struggles. The CST program, oftentimes those kids would be referred to that program basically as a way to get everybody that these families are working with at the table at the same time. So they're not having to have so many meetings with so many different people and relaying the information from meeting to meeting to meeting. So the program itself was more of a philosophy than a program. And we have, through many of our programs, we've implemented that philosophy across the programs, and it's a wraparound program. So between CCS and the children's unit and the CLTS program, we're having those team meetings. We're getting everybody together to talk about the same things at the same time. And with this program, and I guess I don't know, Terry, you would know better than I do, if it's always been the same amount of money that the county can receive to run the program, which currently is $60,000. And historically, there was a county match that was required, and we could basically allocate that match to when we'd have the team meetings or the coordinating committee meetings, and we had other agencies that came there. We could use in-kind match, and that is no longer allowed. So with the program, the county would need to pay $12,000 for the match to continue the program and to continue to receive that $60,000. So in looking at the kids we've had enrolled in the program over the last couple of years, um, they've really all been kids that are in another program. They're already in CLTS or in our CST program. So they're receiving the same services and that wraparound approach, having those team meetings already. So we have decided to no longer have the CST program due to the need for that match from the county. And at the end of 2025, we were down to only having 4 kids in the program. 3 of them were already enrolled in CLTS and or CCS, And the only child who was not enrolled in another program was eligible for the other programs, and is looking at enrolling in one of those other programs and will also be aging out of youth services soon. I think I kind of covered it in a nutshell, Terry.
I do. I don't think I have anything to add. Yeah, I usually say something, but you covered it all.
Oh, and I should add, the families that were in the program, we've had those conversations with them. They're understanding of what we're doing. We've reassured them, nothing's changing. They're still going to have the same case managers or service facilitators, whatever it might be that they previously had. They just they won't officially be enrolled in the CST program because it's not a program we will be offering anymore.
I do have one thing to add, so I guess I'm not breaking my pattern here. Statewide, this is a trend that a lot of counties are doing. They're just getting away from CST because it's basically a duplication of services and we don't need it anymore. And it has, it was a philosophy. There was no funding for any kind of services back then. So when years ago, it was very easy to spend the money and very hard to fund the program. But then they gave us the CCS program, which matches the philosophy. They have a teaming component to it. So it's a wraparound approach there as well. And all of it is fully funded. So what I've heard at the state level is many counties are deciding this is something that they probably don't want or need anymore. And the long-term support PAC, I believe, or the Children and Families PAC, I can't remember which one it was, is basically saying, this is just kind of, it's gone. Just give the counties the money and let us do what we need to with it, which likely won't happen, but that is kind of the sentiment on the state level, so.
George?
Yeah, I just wanted to say, I think maybe if we say it in the right way, we ought to take credit for, eliminating something that's no longer necessary. If you make it too high profile, you might get some pushback. But, some people complain about unnecessary bureaucracy and all that, and I think we should let people know that we get rid of things that are no longer necessary. It seems to be maybe fit that category.
Okay. Community Health Improvement Plan partnership with Credible Minds Matter.
So just sharing an update, continuing to work on the community health improvement plan. So we do partner with Ashland, obviously Ashland, Bayfield, and Iron Counties partner for the community health needs assessment and the community health improvement plan. We also do this with Tamarack Health Ashland Medical Center. And one of the recent things that we have been working on and is now live and up and going, is the Credible Mind website, Minds Matter. It's a tongue twister for me to get out, so I apologize. But it's essentially a one-stop shop website as far as community resources. So individuals can visit this site, they can create their own personal account. There's access to it's more than 10,000 science-backed mental health resources that after they complete the initial assessment, these are then personalized to their needs based on what information they put into the assessment. And then we have local resources linked in on the back end of it. So depending on, what the individual is indicating based on their questions, it may give them resources for like the PERP or, Tamarack Behavioral Health, CCS program, that sort of thing. So it's all intertwined in there. Free website for individuals to reference and to utilize. And if you register and complete the initial health assessment by February 27th, you could register to win a $100 gift card.
Yeah.
George,
This was bringing that back to the artificial intelligence discussion. It makes me think of that, where you can get an assessment by putting in your information. There's a lot of talk in the media about artificial intelligence starting to do semi-diagnostic work. I'm just really curious about, in our health community, what people are thinking about that and what kind of opportunities and pitfalls we might encounter with people sort of self-diagnosing online. Don't you think that?
George, I just want to share some information based on the Department of Children and Families and the Department of Health Services. They are extremely cautious about using any kind of artificial intelligence because once you put something out there, it's out there forever. So there's very strict guidelines that the counties have to do within our contract with both of those agencies. Including, I mean, and I specifically asked DCF, what about if, the children's unit is writing a court report and they put child 1, child 2, biological mother, biological father, you're not putting in any names or anything, and then you're just putting in information, and they even pushed back at that. So unless there is a closed system, it's going to be very hard to be able to get something approved to use, and you have to get it approved prior to using it. So I think there's a lot of good things that can come out of that as well. And I think it is a time saver and it's a great tool. But speaking of bureaucracy, I think that's probably where we're going to have to start.
Yeah, I'm thinking more like my neighbor doesn't want to pay to go into the clinic and goes online to try to self-diagnose. And what kind of problems we're going to have in our community with just individuals in their private lives trying to think they can handle something without going to see a medical professional.
Your neighbors have already been doing that for more than a decade.
Fair enough.
After Google.
I looked online and it said.
This sounds great.
Okay. And then public health, general update, anything else you need to say?
I think if I had anything that was not already listed as an agenda item. This is general updates. We do have a staff member who is out this week, working with Lake States Environmental to complete their lead risk assessor training. So we will have a certified lead risk assessor on staff again, which is beneficial as we continue as a participant with the Wisconsin Lead Safe Homes program. We did complete renovations and lead abatement work on a home in December. I believe it was finally completed. And we had to contract with Bayfield County to complete that lead risk assessment and then the clearance, which ended up being multiple visits for the clearance because the state has redefined and reduced the acceptable levels of lead for environmental contaminants. So having someone on staff to maintain that program will definitely be very beneficial for us. And then the only other update is the human health hazard season has started early this year. So please remind your neighbors that their refrigerators cannot be left out at the curb unless if they remove the doors or change.
Question again.
Go ahead, George. No, take a break while you do that.
One, any update on microplastics and PFAS type of things? And the second question, we're ending, we're doing a lot of ice fishing right now, and there'll be other contaminants or concentrations of contaminants in certain species, like walleye, I think. Is there any updated guidance on any of those things?
The DNR keeps the fish consumption guidance updated, regularly. I believe it's updated every 2 years, I believe. We did have booklets available, but I don't know if we have any left. We do, as the new ones are printed, we do put those out for individuals to take, and I believe they're probably due for printing again this year, because I think it's been 2 years. As far as PFAS, I know there is a bunch of money that is still tied up at the federal and state level for PFAS remediation, additional research and interventions that they're still trying to work through, that being tied up to actually get it to where it is intended to go to, so it can be of benefit. The last monitoring that I have seen throughout Ashland County, we are within the acceptable recommended levels as far as surface monitoring on Lake Superior, and the DNR 4 years ago now did a sampling of private wells throughout Ashland County for voluntary participation, individuals that were interested, and the majority of those results came back as non-detected.
It seems the news carries stories about this coming issue in some of the lower Great Lakes, like Erie. But I think, thank you. Looks like we're stuck here for.
Yeah.
If we're stuck, I would give you feedback again for the planning committee, George. I would love us to focus on youth a little bit. I know there's a lot of talk. We have very old county and services for old people, and I'm a big believer in that. But yeah, I think if we wanted to focus as a county on being a place where you want to have kids and raise kids, and every kid thrives in the same way that hopefully all adults thrive or could thrive, I think there's real value in that. And specific to the county and this board, I keep sort of like a song I keep singing is Spark. And if we could get Spark with sort of consistent funding in that programs like that throughout the county, I think there's just so much we're saving there. And we as a county won't put levy money towards that. We just use grants, and until the grants run out, it's great. And then the minute the grant is gone, right? I mean, look at what happened to drug court. One day it's there and tomorrow it's gone. 20+ years of work and so much time. And I mean, you just think of, and I know Spark is there because the middle school after school program got shut down because the school couldn't fund it, so they closed it. And that's a tragedy. And however we can try to, like, big picture vision, I mean, that's, every time I hear you bring this up, that's the thing that I just wish that we could, but again, that's just me, so I don't want to speak for anyone else. But while we had a little extra time, I thought I'd give it another plug.
And I think even on the agenda, it says second public comment period,
Right.
Yeah.
So thank you for that. That's really important. We hear so little of the input.
Are we on written materials now, or any comments, questions about the written materials? We're gonna go through this page by page, are we? Okay, well. If there are no comments or questions, then board member updates and possible agenda items. Future meeting.
I guess just a thought is this line 5 project seems like it's about to happen or start happening. And I don't know if that needs to be anything here. There are just a lot of potential health issues there. Talking about water and PFAS, but also, just thinking about, extra dust in the air, extra workers in the area, some of the risks of, human trafficking and prostitution. And so I don't know if there's a role for this being on our agenda, but I guess, it's something I was thinking about earlier as we were talking, so.
Well, there was a news item, or maybe it was gossip this morning about the city of Ashland agreeing to provide water supply to the Enbridge project, and I didn't know what that entailed. Does anybody have any idea?
Well, they needed a lot of water.
But where does it come from?
Well, they were trying to find a place to get it from, but they want clean water, so they came to Melton Utilities and asked us already, but that was a while ago. We can't supply them with that
But
water.
they need it for their staff or for drilling?
They need it for drilling.
Probably.
So they're gonna wanna pull it from a river or some other source then.
Well, they said they want a clean source of water, so they want it from our pump house, so.
Well, So it was sort of what I was, I mean, for me, it was hearsay this morning that it was
Oh.
reported that city of Ashland had agreed to provide water.
It's on the council agenda
That's
for
what it was.
next week,
Yeah,
I
yeah.
believe,
Yeah.
and so I think you got probably the same email I got about
My wife did that.
let your city council person know, go to the meeting, learn more. I don't know anything more than that email.
Okay.
But those kinds of issues, I mean, they're just gonna be a bunch
Yeah.
of things that may be germane to this body, and maybe it's where you take a reactive approach. I know we talked about it 5 years ago, whenever that was sort of initially an issue, trying to think through emergency response and what if anything does this body have to do? And I think our conclusion at that time was see what happens. So,
And now it's happening.
so I mean,
Yeah.
we're just there, and so it's
Yeah.
worth kind of dusting that off. And yeah, Liz, maybe you've already been thinking about this or in communication, because I know the DNR, yeah, there's just all these different agencies looking at it and working through it, but again, there's still not a clear timeline or.
But there is was the well sampling or stuff with the new village out of Coringo? I mean, that'll be about what, a dozen buildings for housing for the rest of the non-resident employees to do the project. I mean, that's coming along pretty well. I just keep that out there. Have you received any requests for?
That's considered a campground.
Yeah, I think
but
that's
it's-
what-
but
What I heard too,
it's-
it's considered a
yeah, it's
campground.
Permanent cabins.
That's what I was been told,
Did
but
you
it's gonna be used for Enbridge.
And there's,
Yes.
it's, they got sent to zoning.
Oh, okay. So, yeah, cause, yeah, it doesn't look to be that many buildings and no wells and stuff and no septic and so.
Okay, yeah, that's something we should maybe discuss at our next meeting. And speaking of our next meeting, it's gonna be right after the county reorganizational meeting, which we always end up happening, and Laura and Liz online. Dan wants to know if you're interested in being on this board next term so we can kind of get a heads up on who he has to appoint and so forth.
Yes, long as I can remain a Zoom person.
I'm good with staying on.
Okay, we are gonna lose Rich.
Yep.
Cause he's not running for reelection.
Citizen representative.
So this could be our last time seeing Rich.
Well, thanks for your service.
Yeah.
Yeah, it's nice to be with you people, so.
Yeah, enjoy it.
And then on updates, I think, I just wanted to mention this because I don't know how many of you are aware that I think I think Ken Tuckwell was our original sanitarian for Ashland County, and he passed away recently.
Oh.
Yeah.
When we first took it in county, there was always a state program where and we took it in this department, and Ken was the original sanitarian that we had here.
And then he came out of retirement.
Yep.
Oh, yeah, he did, yeah, yep. Second public comment period, if we have any other people that wanna make comments on the comprehensive plan.
I think we covered that.
Yeah.
And we were all.
Next meeting date, April 22nd. Otherwise, if they're,
That right after our reorg.
yeah, I think it's the day after, I think, it usually is. Otherwise, a motion to adjourn is in order.
I will move.
Second.
Motion and second to adjourn, all in favor?
Aye.
I.
Bye. Bye, everybody.
Yeah.
Thank you.
Yeah, yeah.
I didn't know how to spare time.